Now for preventative care, we come back to toxins. Let's talk about toothpaste, because it just seems like there's so many different brands, and sometimes there's a lot more stuff in there than we actually need to be putting in our mouths.
Tom's of Maine, I go with Tom's of Maine. No fluoride.
No fluoride. Why not? What is it with fluoride that's not?
Well, the thing is the reason that I don't is, if let's say that you were the mom and I'm trying to do the best thing for your child, this fluoride thing could be a real contentious thing, which, and it's just not good for the professional relationship with the, with the parents if we butt heads about fluoride. It's important, but it's not insurmountable, just like nitrous oxide. But professionally, my concern is Dr. Usman. Last year I took the DAN conference. I don't think things have changed. Dr. Usman said that fluoride, as she read the literature, increased the permeability of the blood-brain barrier to other potential toxins. It wasn't the fluoride itself getting into the brain. It was that it increased the permeability for other things. So, why would I want to expose any child to the possibility of, that when, it's not absolutely necessary. The question is, how about fluoridated water? How about when the kids go swimming? I mean, what is the deal there? So, I don't know. I don't know if the science. I don't think the science has been done. But the way around that is, let's just go with a non-fluoridated toothpaste that doesn't have any preservatives that that the moms are happy with. Tom's of Maine seems to be one of them. So this is where I'm at.
That's a good thing to do. What do you think? There's anything that you would want parents to know about their children's dental care? Are there commonalities that you're seeing? Maybe they don't have the proper protocol, or are they not brushing well, or what do you think parents are missing?
Well, probably the same issues that neurotypical parents need to know, plus the specialized dietary problems with kids in the spectrum. So, nursing bottle decay, sleeping with a bottle of milk or juice or anything except plain water. Now, we can get around the fluoride thing is most bottled water does not have fluoride. Or you can buy nursery water that specifically says does not contain fluoride. That would probably be the safest thing to do, is buy nursery water that says does not have fluoride. Very difficult to get fluoride out of water. Whatever filter you guys have, it's not going to take it out. I mean, it's a very expensive, complicated thing. So if a child is sleeping with a bottle and napping with a bottle, it's got to be plain, non-fluoridated water. Otherwise, anything else can rot your kid's teeth. Milk, soy milk, apple juice, any kind of Propel water, any fruit juice, just anything. The milk of the juice sits there. The nipple is between the tongue and the roof of the mouth. It just pools around there. The pH of the juices below 5.5, which is what you need for a tooth decay, and the lactose sugar in milk gets converted by the bacteria, by the plaque that's around the teeth, converts the lactose into acid, eats away at the teeth. So that's what every parent's got to know. The way around that is hold your child when the child is having a bottle. No propping the bottle in your kid's mouth. Doesn't matter what your mother-in-law says. She could have raised 14 kids and never happened. It happens. It happens quite a bit. Number one. Number two, the sippy cup. If your child uses a sippy cup in between meals, non-fluoridated water only. No Propel water, no juice. These kids very often do not swallow everything that's in the sippy cup and walking around nursing this stuff for long periods of time. So that's what both parents have to know. But specialized area things with children on the spectrum, what is the therapist using for reinforcers? It should not be gummy bears or fruit roll-ups or anything that's sticky. And if your child craves orange juice and they're going to have it 24/7, we're going to have problems with your kid's teeth. If your kid's on a alternative milk, rice milk, for example, very retentive, sticks to the kid's teeth. especially if they're hypotonic and their tongue and the lips are not doing self-cleansing. You got to brush your child's teeth every time that kid has rice milk, because it sticks. It's a carbohydrate. It gets broken down by the salivary enzymes at the acid. It can rot your kids' teeth. So those are the biggies.
I think it's great. We talked just off camera a little bit about braces, and you touched base on that. Do you think? What do you think of some of the plastic versions, like the Invisalign, or do you have any opinions that plastic is better versus metal, or?
Yeah, well, we're fortunate. Dr. Pam Johnson, who presented yesterday with Dr. Gannon and Dr. Lancaster, and I, is an orthodontist. She's got a child with a developmental disability. She's worked out several protocols to deal with children with developmental disabilities in general and children with autism specifically. Her experience and our experience in general is that the children on the spectrum who can tolerate braces do okay as far as allergic reactions to them. But we were talking about that there are reports, and the Tucker moms would know better than anybody, because you have a network and it gets fed into a central source, that apparently there can be a reaction, and there can. I mean, we use plastic, polycarbonate, other type of plastics. They use stainless steel. I still haven't gotten straight which stainless steel has nickel and which doesn't. But apparently the nickel can be a problem. Some of these wires have titanium. Then you get the whole thing about what they're gluing these things on with. They have these adhesive systems where they etch the teeth, use dilute acid to make little minute scratches in the enamel of the teeth. Then they use an intermediate bonding agent similar to what we use in sealants. Then they use a glue, which is similar to sealants, and it puts the plastic bracket onto the tooth. So you got all the stuff that's in that. Now, ideally, the tongue, everything should be away and not touch that until it's set, and then all the polymerized, the unhardened chemicals should be wiped off the teeth, and then it shouldn't leach anything out. But, nanograms of this stuff can, touch the tissues, and it can be, absorbed. So, again, the more allergic your child is, the more, I think, vigilant you have to be. And probably the younger your child is, because you just don't know from experience what your child can tolerate or not. And you have to find a orthodontist like Dr. Johnson who's willing to listen and find out, call the reps, call the suppliers, what's in the stuff that we're using. Because dentists are like everybody else, We just use it. We don't know how our drill works necessarily, just like people may not know how the internet works, but we use it all the time. And nobody really asks us what's in this stuff. I mean, as long as it works and it's got the American Association seal and it's from a reputable company and it's been on the market a while, and there are news or letters that does testing whether it works and what do other dentists think, but we don't do enough toxicological studies.
I see. One last question. When a parent's looking for a pediatric dentist, are there any questions that they should ask or tell that dentist prior to coming in if they have a child with autism? Is there something, what makes you stand out from your average everyday pediatric dentist?
Well, because I've had the opportunity to see hundreds of kids, talk to hundreds of moms, learn from Ed Aranger over 8 years, read the Schaefer Autism Report, and just have a very keen interest in it and have had an open mind. Most dentists have not had that opportunity, and autism can be sort of like an unwanted challenge. Like, I got enough problems, now I have this disorder which I have no idea what it's about. It seems kind of scary. This kid seems kind of weird, and the mother seems awfully uptight and a little hostile. So, I mean, there's not much in it for the average dentist. But, so I would try to network and find a dentist that is, has a lot of children with autism. No one knows what the dentist is thinking. They may be doing it because they just have to. But if they do their job, you may not like the surgeon that you're going to, but technically this surgeon can do it. So if the dentist has experience, seems to know what they're doing and does good work, I think that makes sense. But at the same time, you have to be comfortable with them. If you get bad vibes that this person, you're just emitting a lot of negative energy, doesn't seem to like your kid, sort of wants to get this done. I would somebody who really wants to see children with autism. We want to see children with autism. We want to provide the service. We got a lot of this Yiddish word rachmanus for the parents. We have some idea what it's like. We want to make your life that much easier. Dentistry should not be something that's a problem. Deal with your pediatrician. You have enough issues. Deal with people's marriages with the stress that autism is. Coming to the dentist should not be one of them. And we also like kids. And the kids with autism are just as likable as any other kid. So find someone that wants to do it. Is what I would want to say. The differentiation should be someone who that is the difference. If you want to do it, you'll learn how to do it. You'll learn what you need to learn. Because there aren't that many things that you have to modify from regular pediatric dentistry for children with autism.